serial tumor marker measurement, and there will also be 3-month ECG of the chest abdomen pelvis for 1 year, or by 6 months. The next year there will be 6-month ECG chest abdomen pelvis. Question 19. Bilateral testicular maculolithiasis, bilateral testicular maculolithiasis, and unilateral testicular atrophy. History of orthopexy or atrophic testicle, most appropriate management, follow-up clinical examination, and surveillance sonography. Bilateral testicular maculolithiasis and unilateral testicular atrophy. History of orthopexy of the atrophic testicle, most appropriate management, follow-up clinical examination, and surveillance sonography. Because this testicular maculolithiasis is associated with germ cell tumor. Number 20. Renal pelvis shows transversal carcinoma. The cancer invades adjacent renal parenchyma and extends into perinephric fat. What is overall state of this cancer? Stage 4. When it extends to perinephric fat, it is T3, or serosa, crosses serosa, T3, and adjacent parenchyma, adjacent renal parenchyma, T4. So T2 is up to serosa, or up to perinephric fat, but extends beyond perinephric fat in T3. But it also infects the adjacent parenchyma, then T4. So cancer invades adjacent renal parenchyma and extends to perinephric fat, T4. Question 21. Ultrasound shows identifies dense shadow casting abnormality of the periphery of both fora cavernosa, which is likely diagnosed by Peyronie's disease. Ultrasound the penile urethra shows dense shadow casting abnormalities at the periphery of both fora cavernosa, most likely diagnosed Peyronie's disease. Is the fibrosis of the penile urethra. Number 22. Surgical scrotal exploration. They seen that one testicle has a high insertion of the tunica vaginalis on the spermatic cord. What proportion of patients with this condition have bilateral disease? 5%. On surgical scrotal exploration, it is seen that one testicle has a high insertion of the tunica vaginalis on the spermatic cord. What proportion of patients with this condition have bilateral disease? 65%. 24. Breach of this layer is upstaged penile cancer from T1 to T2. From the following choices, name the structure or structures. Tunica albuginia. 24. Breach of this layer upstaged penile cancer from T1 to T2. From the following choices, name the structure or structures. Tunica albuginia. Breach of tunica albuginia upstaged penile cancer from T1 to T2. 25. Biopsy-proven ovarian cancer. Which of the described features results in a classification of stage 4 disease? Liver parenchyma deposits. In ovarian cancer, which feature results in classification of stage 4 disease? Liver parenchyma deposits. That is, distal metastasis is shown stage 4 disease in ovarian cancer. 25. TMSA scan with the patient sitting. Only 30% contribution to the total trace activity from the right kidney. When the counts are repeated supine, the contribution from the right kidney is 50%. Where most likely abnormality of the right kidney, nephroptosis. It is important that when the patient is sitting, then only 30% contribution of the total trace. When patient is sitting, only 30% function of the right kidney, and when the patient is supine, then the contribution of the right kidney is 50%. So most likely diagnosed nephroptosis. This is secretion of kidney's activity differentiates in sitting and standing. So sitting and supine position. So diagnosed nephroptosis. Yes, Anna, you want to sure. 27. History of renal cell carcinoma. CT scan 1 month after the ablation quantifies the average post-contrast enhancement of the tumor at 8 HU. We have found best represent degree of success of the frequency ablation successful. The patient had history of renal cell carcinoma, and CT scan 1 month after the ablation. He underwent ablation, and after 1 month CT scan shows the average post-contrast enhancement of the tumor at 8 HU. Which of the following best represent degree of success of the frequency ablation is successful? Question number 28. Biopsy-proven adenocarcinoma of the cervix. For local chaining, which of the following the most appropriate technique? MRI with pelvic phase array coil, because we already did TVS and biopsy. Patient had adenocarcinoma of the cervix. We already did ultrasound. We already did biopsy. Now, for local chaining, what is the most appropriate technique? MRI with pelvic phase array coil. Patient had biopsy-proven adenocarcinoma of the cervix. So when we did biopsy, we have already done TVS and biopsy. What is following the most appropriate technique for local chaining? MRI with pelvic phase array coil. 29. End order sound. Scarring is seen involving more than 50% of the external figure, but the internal anal figure intact. Figure following best represents the degree of perineal injury. Third degree perineal injury. Third 3B, 3B, 3B. Why? Because in one skin is only involvement of skin, scarring of only skin is one stage one, and two there's muscle involved, and three there's external sphincter involved. But in the external sphincter, less than 50% to 3A, and 3B is more than 50% external sphincter involved. So here they are saying that more than 50% external sphincter is involved. So degree of apparent energy is third, so 3B, correct? Question number 30. Ultrasound can show 20 mm tumor in the cortex of the interpolar region of the left kidney. This can confirm an enhancing mass in the same location, or DMSC expects this abnormality as good uptake. Which of the following is the most appropriate management? No further action. This good uptake is with cortex hypertrophy. Now, ultrasound can show 20 mm tumor in the cortex of the interpolar region of the left kidney. This can show the enhancing mass in the same location, or DMSC expects this abnormality as good uptake, which means that DMSC is used in renal function, strict renal function. And good uptake means it is just like renal parenchyma tissue. With most appropriate management, no further action. Because good uptake shows that it is cortex, it is cortical the diagnosis is cortex hypertrophy. 31. Histology of pheochromocytoma. MIBG scan is done. Activity in which of the following organ is most likely to be a metastasis? Lung. Patient has histology of pheochromocytoma and MIBG scan is done. Activity in which of the following organ is most likely to be metastasis? Lung. Pheochromocytoma most likely metastasize to lung. 32. Cervical lesion in squamous carcinoma is seen. In such cases, local image staging must indicate which of the following: tumor size and distance from the internal os plus the cervical length. There is a cervical lesion and it is diagnosed as squamous carcinoma. Now, in such cases, local imaging staging must indicate which of the following: it should say the tumor size and distance from the internal os plus the cervical size in carcinoma cervix. Question number 33. Squamous cell carcinoma of the vulva. MRI shows a short axis equilateral 1.2 cm external iliac node that has signal characteristic identical to the primary tumor throughout, with the most accurate nodal staging N1. Because it is 1.2 cm external iliac lymph node, so it will be N1. A single. Squamous cell carcinoma of the vulva. MRI shows a small short axis equilateral 1.2 cm external iliac node that has signal characteristic identical to the primary tumor throughout, with the most accurate nodal staging N1. 33. Which of the following MRI sequences would be most useful in detecting original cell carcinoma among numeric or pertinacious cysts? T1 W postcranium with pre-contrast, T1 W signal subtracted. Complex image. We are trying to detect original cell carcinoma from hemorrhagic or pertinacious cysts. So with this we do T1 W postcranium with pre-contrast T1 signal subtracted. Because remember that it is that we do a complex imaging, so we subtract T1W signal from it. So, which of following MRI signals most used in detecting original cell carcinoma among hemorrhagic or pertinacious cysts? T1W postcranium with pre-contrast T1W signal subtracted. 35. 18 FDG PET scan to look for recurrence. A false negative result will be caused by which of the following scenarios? Peritoneal deposits smaller than 1 cm. 18 FDG PET scan to look for recurrence. A false negative result could be caused by which of the following scenarios? Peritoneal deposits smaller than 1 cm of PET scan in PET scan. Question 36. Biopsy proven prostate carcinoma. MRI shows bilateral multifocal peripheral zone, low signal change on small FOV T2W images in locations corresponding to one or more scan plane. These changes are confined within the prostate capsule, and long-term nodes are seen in the left internal and common iliac lobe, where the TNM staging T2C and 1M1. Common iliac node is M1. Now look here. Prostate cancer staging, stage 2, the cancer is larger and may be in both lobes of the prostate, but still confined to prostate. So, perhaps you proven prostate cancer, MRI shows bilateral multifocal peripheral zone dose signal changes on small FOV T2 images in locations corresponding to more than one scan plane. For bilateral, so stage 2, and these changes are confined within the prostate capsule. Enlarged lymph nodes are seen in the left internal and common iliac group, most TNM staging, and 1M1. Now, since common iliac group node is involved, so M1. 37. Single adrenal mass of diameter 35 mm. Unenhanced CT shows average attenuation value is 30 HU. On a CT time at 60 seconds of attenuated contrast medium injection, the attenuation value of the mass is 90 HU. By 15 minutes after contrast, the attenuation value is 50 HU. By most diagnosed lipid poor adenoma. There is adrenal mass seen on unenhanced CT. The average attenuation value is 30 HU. On CT time 60 seconds after attenuated contrast medium injection, the attenuation value of the mass is 90 HU. By 15 minutes after contrast, the attenuated value is 50 HU. For the most likely diagnosis, lipid poor adenoma. Right? First, after 60 seconds after attenuated contrast medium injection, attenuation is 90 HU, but by 15 minutes after contrast, attenuation is 50 HU, so most likely diagnosis, lipid poor adenoma. Because lipids have an HU of in minus, I think. Lipids HU is on values. Page 38, in IBU for uterine colic. Venous calyces are noted to be club-shaped on the side of the pain. Renal calyces are noted to be club-shaped. Club-shaped renal calyces seen in renal papillary necrosis. So renal calyces are noted to be club-shaped on the side of the pain. On the same image, there is a triangular filling defect in the renal vellus. The colic is most likely to be caused by which of the following? Slow papilla, club renal calyces. IV for uterine colic. Renal calyces are noted to be club-shaped. Seen in renal papillary necrosis on side of pain. On same image, there is a triangular filling defect in the renal pelvis. The colic is most likely to be caused by which of the following? Slow papilla, club renal calyces. Biopsy-proven penis cancer. MRI performed. Which of the following is the best reason for performing this examination? To perform local staging. In penis cancer, MRI is performed. Best reason to perform MRI in penis cancer to perform local staging. 40 abdominal film is unremarkable. CTKB shows ureteric dilatation and periureteric stranding down to the vesicular junction on the side of the vein. No radio-opaque calculi are seen on CT. So, ureteric calculus, which is radio-opaque on CT scan and X-ray, are most likely ureteric stone, and they are seen in AIDS HIV patient. Ultrasound shows tiny density embryonic focus within bladder wall at the same vesicular junction. For which of the following conditions the patient most likely to have been repeated treatment? HIV. The abdominal film is unremarkable. CTKB shows ureteric dilatation and periureteral stranding down to the vesicular junction on the side of the sphere. So the stone is not visible on abdominal radiograph of CTKB. The most likely ureteric calculus is seen in HIV patients. 41. Patient with a lower ureteric transient cell carcinoma, MRI shows an 8 cm short axis node recorded. Which of the following abdominal pelvic groups would this be significant by size criteria? Internal iliac. In 8 mm is a big and internal iliac node. In internal iliac, 8 mm is a big node. 41. Patient with a lower ureteric transient cell carcinoma, MRI shows an 8 mm short axis node is occurred. And which of the following abdominal pelvic groups would this be significant by size criteria? Internal iliac. 8 mm is biggest internal iliac nodes. 42. A 10-week dating ultrasound shows twin pregnancy. A repeat examination shows single-cell pregnancy and no evidence of the twin. What should this be termed? Vanishing twin. In pregnancy ultrasound, twin pregnancy, a repeat examination shows single pregnancy and no evidence of the twin. Should this be termed? Vanishing twin. Correct? Question 43. Cervical carcinoma. Primary tumor is 5 cm in longest dimension, is seen to involve the uterine corpus and has small volume perimetrial spread.